Shri Ganesha. Hello all, I'm Vanashri.
And I'm Dia. Today we will be presenting complications in pregnancy with yogic point of view. When a woman finds out she is a Garbhini, her thoughts and emotions may go into overdrive. She might be as excited about this Garbha whom she will bring into the world as she may be terrified that something may go wrong. Most pregnancies progress without any Garbhapata. It can be scary to hear that doctors have diagnosed a complication. With early detection and following Garbhini Paricharya, she increases the chances of keeping herself and her Garbha healthy. Complications in pregnancy can be classified into two main categories. The first one being maternal, that is Matrach, and the second one is fetal or placenta, that is Garbha or Apara. Now, Vanashri will cover the maternal complications in pregnancy.
Hyperemesis gravidaria. Many women experience nausea and vomiting symptoms in the pregnancy, but with the HG, it is severe and may need hospitalization. In this condition, Garbhini may have significant weight loss and dehydration, which can lead to lack of enough nutrients for the mom and the baby. Kate Middleton also suffered from this. We can help this condition with by doing the yoga like Sukshma Vyayama and also Pranayama, Ashwini Mudra and Apana Vayu Mudra, some meditation. Preeclampsia. Preeclampsia is the condition that causes dangerous high blood pressure. They may have severe headache, vision change, and pain under the ribs. Having a history of high blood pressure, obesity, teenage mothers, or those over 40 are at the high risk. In severe cases, it can cause life-threatening seizures known as eclampsia. Sukshma Vyayama, Dirghasvasan, Anulom Vilom, Brahmari, Ashwini Mudra, and all types of meditation can help us. Deep vein thrombosis. Deep vein thrombosis is the development of the blood clot in the deep vein. Carrying a baby puts a pressure on the veins in the Garbhini's legs and the pelvic area. We can prevent this by doing exercise, yoga, asanas like Uttanasana, Sukshma Vyayama, Virabhadrasana, raised leg on the chair, which can help reduce the thoughts, Ashwini Mudra, Pranayama, meditation. Let's look into one more, that is gestational diabetes. Gestational diabetes is a condition in which your blood sugar level goes high during the pregnancy. It is the type 2 diabetes. Doctors screen for that between the 24 and 28 weeks of the pregnancy. It is more common and can affect anyone. Halle Berry, the Oscar-winning actress, developed the gestational diabetes. There are two types of classes for the gestational diabetes. Class A1, where you can manage it with the exercise and diet. Class A2, where you have to take insulin or some medication. I had developed the A2 diabetes for my first pregnancy, and the second one was normal pregnancy without the diabetes. If I would have known the Garbhasanskar, I would have avoided having this. Let's move on to the symptoms. Symptoms for the gestational diabetes may or may not have any outward signs or symptoms. Outward symptoms include feeling thirsty, hungry than usual, or urination more than usual. One who is overweight or have a history of GDM are at the high risk. Baby may grow much larger than normal, a condition called microsomia. If baby size is too big, cesarean can be recommended by the doctors. Prevention. We can definitely prevent it with the yoga asanas and some diet. Pre-pregnancy, we can do the asanas like Vakrasana, Ardha Matsyendrasana, Dhanurasana, Pavanamuktasana, Salabhasana, Bhujangasana. During pregnancy also we can follow, continue doing the yoga asanas which are appropriate, like Kati Chakrasana, Virabhadrasana, Marjory Asana, Supta Baddha Konasana, and some practices like pranayama, Vastrika, Anulom Vilom, Brahmari can also have. Fetal and the placental complications will be covered by Dia. Thank you.
Thank you, Vanashri. Let's start with the first one, that is ectopic or tubal pregnancy. An ectopic pregnancy occurs during the first trimester when the fertilized egg attaches itself in a place other than inside the uterus. The woman may experience acute abdominal pain, vaginal bleeding, or spotting. She might feel dizzy or have some blackouts too. Women with previous ectopic pregnancy, previous pelvic or abdominal surgery, PID, and endometriosis are at risk. Placenta previa. In this, the placenta is either totally or partially, it covers the cervix. The most common sign is bright red bleeding from the vagina during the second half of her pregnancy. Pregnant women having scar on the uterus from previous pregnancies or uterine surgery or fibroids are at risk. For a full placenta previa, avoid doing any yoga asanas. Instead of this, the woman could practice doing some yoga nidra and visualizing the placenta moving out of the way. This is really powerful. And for partial previa, she can practice some asanas on the chair, such as seated Garudasan, Veerbhadrasan, Parshvakonasan, but all on the chair. Now moving on to placental abruption. The placenta partially or completely separates from the inner wall of the uterus before the delivery, most likely to occur in the last trimester, and women might experience some vaginal bleeding, abdominal pain, back pain, uterine tenderness or rigidity, and she might experience some uterine contractions too. The possible causes include trauma or injury to the abdomen or the water break. It is a life-threatening problem for both the mother and the baby. Now we'll cover the miscarriage in detail. Pregnancy loss from natural causes before 20 weeks, often miscarriage occurs before a woman even knows that she is pregnant. The symptoms include vaginal spotting or bleeding, cramping or abdominal pain, fluid or tissue passing out of the vagina. The 4 types of miscarriages are: the first being threatened miscarriage. When the body is showing signs that the woman might miscarry, that is called as a threatened miscarriage. She may have a little vaginal bleeding or lower abdominal pain. It can last for days or weeks and the cervix is still closed. The treatment: the pregnant woman is recommended for complete bed rest, no intercourse, and is given medicines which have postagenone in them to stabilize the uterus, to stop the contractions so the baby can rest inside peacefully. The pain and the bleeding may go away and she can continue to have a healthy pregnancy and a baby, or things may get worse enough and she might go on to have a miscarriage. Sometimes some pregnancy tissues will remain inside in the uterus, and vaginal bleeding and lower abdominal cramping may continue as the uterus continues trying to empty itself. This is known as incomplete pregnancy. The third one is missed miscarriage, where sometimes the baby has no heartbeat and still stays in the uterus. And the last is recurrent miscarriage, in which a small number of women have repeated miscarriages. The emotional support that we can provide to ectopic pregnancy women or after a miscarriage is that having a miscarriage can lead to a variety of different emotions. And it is important to recognize that there is no right or wrong way to feel while she is recovering from a miscarriage or ectopic pregnancy. A healing restorative yoga sequence can be really helpful to her. This sequence is an offering of relaxation, so her body and her nervous system can hit the reset button and help her restore the equilibrium. So after 2 weeks after the miscarriage, she can do some asanas such as Supta Baddha Konasana, Balasana, Supta Virasana, some guided meditation and Brahmari Pranayama. However, to avoid such consecutive miscarriages, she has to do some prenatal asanas that would strengthen her pelvic muscles and balance her hormones too. Pregnancy is an amazing time in a woman's life when phenomenal changes take place on a physical and emotional level. To prevent all these complications, Garbhadhan Purva Samskara is the foremost samskar recommended for couples trying for the conception.
Garbhasanskara and yoga are the excellent way to prepare for the pregnancy and the childbirth and to minimize or prevent many of the common discomforts and complications in the pregnancy that we have just seen. Shuddha bija, pure sperm or ovum, gets fertilized inside the uterus or on time, and the mother nurtures the fetus with a nutritive diet and a yogic lifestyle. Modified yogasanas practiced during the first, second, and third trimester bring following benefits to the pregnant women: body awareness, keep in shape, reduction of stress level, connect with Garbha, and easy delivery. Thank you all.
Thank you.